All right, everybody, welcome to Stop Ending Back Pain. We're going to give a nice talk today about how to end back pain without addictive drugs or surgery. Just saw a patient today has a major neck surgery, opened up the front of her neck, two screws here, and a big plate between. We took an x-ray. She couldn't believe all the crazy hardware in there. So we're just going to make sure we end back pain, neck pain, all those things without any kind of dangerous drugs or surgery. So we're going to get through some slides. Hopefully you learned some information, and we'll send this out. So not everyone here. We got people from all over the world on this Zoom today, so we're going to give a little bit about myself. That's my picture right there with the cool bowl cut. I think about third grade. Grew up in Mount Olive Township, just about 10, 15 minutes up the road. I was a pretty athletic kid. There's another school picture with the bowl cut as well. Parents were pretty mean. So I grew up right down the street, an athletic guy, played a lot of basketball, a lot of other sports, football and soccer and all that kind of stuff as well. There is my embarrassing prom picture just for that little reference there in the 90s. Pretty cool. But then when I was 13 years old, something happened and changed my life forever. So I was driving to a wedding in upstate New York where my dad's family is from. We got sideswiped by a car. The four of us ended up at the hospital for a couple days, concussions, collapsed lungs, that kind of stuff. I ended up with a pretty bad back problem. Couldn't get off the floor. I'd come home from school and just lay on the floor for hours on end. Nobody really helped me out with my pain at all. Saw a bunch of doctors. Couldn't play any sports. My mother finally took me to a chiropractor, had me fixed up in a couple weeks, got me back to playing basketball, which is what I loved. And I decided at 13 I was going to help people just like I was helped. And I've been doing this for 22 years now, helped a lot of your friends, neighbors, and people in the area. If you don't know, I'm a best-selling author. Ask Dr. James Fedich. Yes, you can live a pain-free life. If you're ever in the clinic, we have free copies around the office. Here's the Amazon best-selling book. I've written some magazines, articles as well. But just the Amazon bestseller book. If you ever want a copy, just let us know if you're down here. That's my wife and kids. So we got Scarlett up there. She's turning 11 next week. And that is Britton. He just turned 8. And my lovely wife, Kristen. It's us at the beach last year for vacation. So now, if you don't know where we are, like I said, we got people all over the place on this Zoom today. We're located in the Alamucci Corporate Center, big red brick building in Alamucci, across the street from the Panther Valley Mall, right on Route 517. Just had a patient come from Pennsylvania. So it's really convenient because we're like less than a mile off Route 80, exit 19. We'll show you a map a little bit later. So let's go back one here. All right, so let's just bring this back a couple. There we go. All right, so there's a family again. Again, Alamucci Corporate Center, right down on 517. Hackettstown's a mailing address, even though it's kind of Alamucci. All right, so we're going to talk about back pain today. So how common is back pain? Just some stats here. So 50% of all people are going to have some lower back pain every single year. Most of these problems are mechanical. So a lot of times people will say, is it my kidney? Is it my colon? Those types of things, organs. It can be, but it's very, very rare. Almost all the time it's a mechanical problem, which means it's nerves, muscles, and bones, which is what we take care of as chiropractors. Mechanical dysfunction defined as the largest category. Again, 90% of back problems are from mechanical origin. So it's very unlikely it's an organ, those types of things. Of course, you rule that out if it's an issue, but most of it is a mechanical problem, bones, muscles, and nerves. 7 out of 10 of these are due to postural fatigue and spinal strains. So that's a lot of big words, but basically what you've heard is sitting is the new smoking, right? Where most people are on computers, desks, hunched over all day. And most of the problems are from that. It's not from the car wrecks, although that does happen. And these injuries, most of it's from posture, sitting at a desk all day. All right, so what is health? So a lot of times, what is health? A lot of times people say it's feeling good, not having any major medical problems. According to the World Health Organization, optimal health is the absence of any kind of problems at all and feeling as perfect as we can. So it's not just being pain-free, it's living life close to 100%. So we draw a scale sometimes, I think we have it coming up in a minute, but just having no pain does not necessarily mean that we're healthy. Everybody has a friend who was 50 years old and ran marathons and drops dead of a heart attack, or everything felt good and they had some cancer growing in them, something like that. So just not feeling good doesn't mean that we're healthy. Another analogy we give is a dentist. We've all been to the dentist. Your mouth feels just fine, but they find a couple cavities or other issues as well. Oftentimes things don't hurt until they're really, really bad. So just because you feel good doesn't necessarily mean that you're healthy. So this is one analogy you give. So what's the number one symptom of heart disease in America? So a lot of people say chest pains, arm pains, headaches, those kind of things. Actually, the number one symptom of heart disease in America is death. So about 40% of people have no idea they have a heart problem until they die, actually. So the first symptom is a major heart attack and death. So obviously they felt good the day before, everything seemed okay, but the heart was obviously not functioning properly. So that's why it's really important to check everything with your health, because just because you feel good doesn't mean that we're not having a problem. So back to the real definition of health. So what it is really everything working as close to 100% as possible. And they did a study with chickens years ago, and they found they put pressure on the nerves of the chickens and see how bad the nerve would have to be not working before there'd be any kind of symptom. And what they found, and they've done a couple studies to confirm this, that you don't feel anything until about 40% function. So that means if your heart's supposed to work at 100%, and actually the heart number is 40 as well, if your heart should work at 100%, you don't know anything's wrong until it's only working at about 40%. So I don't know about you, but I don't want my heart only working at 50% at any given time. I want to work at 100% all the time. And that's the goal of our chiropractic care. We want everything functioning as close to 100% as possible. It's not just not feeling bad, it's feeling as good as you can and functioning as well as you can. There's a lot more to feeling good again. To make sure everything works properly, and works in conjunction with each other. Everyone's had a friend with restless leg syndrome or something where the brain and body just aren't talking properly together. We want to make sure that doesn't happen with you. All right, so how does this all work, right? So up top we have our brain and the spinal cord running down. The brain sends messages to every cell, tissue, and organ in the body. So if you touch a hot stove, your brain sends a message down through the nerves in the neck, all the way down the arm to the finger. You touch that hot stove, that message of the heat goes all the way up those nerves in the neck and brain. Your brain says, oh boy, that's hot. Has to send a message all the way back down to the finger to tell you to move it. And if you ever touch a really hot stove, you know how fast that happens, but that's all the communication needs to go back and forth. So even to move your pinky toe, that message has to start from the brain, run through all the bones in the spine, down the nerves in the leg, and all the way down to that pinky toe. So a lot of times I just had a patient with some hip groin issues that we found out that was coming from the lower back because that nerve was getting pinched in the back, causing pain down there. Same thing, I must have every couple of weeks, the patient had carpal tunnel surgery and they still haven't tingling in their fingers. And what ends up happening, we find out there was a pinched nerve in the neck, shooting pain all the way down to the fingers, and it wasn't from carpal tunnel. So it's really important to maintain all these spinal nerves working properly. So there's a picture of your brain. So your brain's up top. Obviously surrounded in bone, which I'll show you in a second, and then it runs down as the spinal cord. And again, this controls every cell, tissue, organ in the body if the brain needs to work properly. So what it looks like is this. So the brain's encased in bone. There's more bone around your brain than anywhere else. Anyone with kids or anyone that's fallen, you know, you can bang your head pretty hard before you end up with a big problem. So it's the hardest, densest bone in your body, and rightfully so. Brain's obviously very important. You can't breathe or do much of anything without a brain, obviously. But as the brain comes down through the spinal cord, that's also encased in bone. These bones are called vertebrae, and they're also the second hardest area of bone that are totally encasing the spinal cord. Spinal cord is very important as well, but because we need to move and bend, these bones are movable. They need to move and shift so that we can bend and twist and move around. Those nerves come out of little gaps in between the vertebrae, little foramen or little holes. We call them nerve channels, make it easier. So as a nerve comes out, goes to your eye, your heart, your lungs, every muscle in the body to contract a muscle, move a muscle, and all the way down to your foot. And as you can see in between these vertebrae are little spaces for those nerves to go out to every cell, tissue, and organ in the body. So what can happen is these bones can get shifted out of place, and then they can pinch, choke, rub, or irritate those nerves. So as we're bending, twisting, falling, sitting at a desk all day, just normal everyday activities, these bones can shift out of place and start pinching or rubbing one of these nerves. And then wherever that nerve goes, we can have a problem. So people that go to the chiropractor a lot of times for sciatica, nerve pinch in the back down the legs or in the neck to the arms, but that nerve can go anywhere. It can go to the heart, lungs, any tissue in the body. We'll have patients get better with digestive problems, asthma. I just talked to someone today about that. So wherever that nerve goes, we could have a problem for that nerve being pinched off in there. So what we want to do is that structure, we said that bone shifted out of place, it's pinching on the nerve, that can make things not work properly. So anytime that things aren't working properly, we could have a problem. So that's the structure of the vertebrae are making the nerve not work properly. So with chiropractic care, if we can correct that structure, then the nerve will work properly. So a lot of patients, I had one today, a lot of leg pain. We don't even touch the leg because there's nothing wrong with the leg. It's the nerve in the back. We correct that structure in the lower back. That alleviates the pressure up the nerve, which gets that leg feeling better. All right, so we got a little bit more anatomy here. So we teach one of the bones of vertebrae we were talking about is our intervertebral disc. So the disc, I always tell patients, like a jelly donut from Dunkin' Donuts. We got that nice ring around there, some jelly inside. It's kind of the body's natural shock absorber. It also helps space those vertebrae apart for those nerves to exit in between. So we're sitting, standing, all that stuff all day is just squishing those discs, especially in the lower spine. All your body weight's pushing down on that disc all day long, and we can sometimes have some problems with those discs. So again, we have this jelly inside, and there's rings around to hold it all there, and they're sitting right next to those spinal nerves. So people have often heard somebody say they have a bulge disc, slip disc, herniated disc. I just had 3 patients on car wrecks with slip discs today. Some of that jelly, that donut, can come out of the disc and rub the nerve as well. So that's another way that we can have a pinched or irritated nerve in the spine, which we're going to talk about in just a second. All right, so what are some things that we looked at, ignore a lot of times? People say they feel good, everything is going well. One of the biggest things is sleeplessness. I do a whole talk on not sleeping well. It's becoming a bigger problem in this country. People don't sleep well, stress, muscular problems. Most of the time not sleeping well is actually musculoskeletal problems. So yeah, stress, anxiety, sure, but most of the time it's your back hurting, your neck hurting. Something's keeping you up at night that way. Other things we tend to ignore: nervousness, stress, headaches, fatigue, blacking out, often falling asleep as well. So there's a lot of other symptoms besides pain. That's one of the things about irritate. It's not just things hurting, which means something's not working right. We're not feeling right. We're feeling off. We're tired, restless, not sleeping well, or all the symptoms something's going on. So again, we talked about this earlier, but is health merely the absence of symptoms? So if we don't have any aches and pains, are we healthy? Like we said before, we've all known somebody who was a runner athlete, they had a heart attack, or they felt fine, there was cancer growing in them. We all know that not feeling well doesn't mean that we're healthy. So if we don't have symptoms, doesn't mean we're always symptom free. Right, so there's little misalignments to the vertebrae we talked about before. Bones, vertebrae, the disc in between, the nerves exit. Chiropractors use the word subluxation. All that means is any misalignment, slight misalignment of those vertebrae can cause pressure, irritation of those nerves, causing a problem wherever that nerve may go. So any minor deviation of those joint mechanics can put stress on the nervous system. So any of these nerves are getting irritated from subluxations or misalignments, cause pressure, pain, or any kind of symptom like numbness, weakness, even your heart and lungs not working properly, and things like that. So one of these nerves being pinched in the spine or subluxated, a lot of times it can be symptom free. Like I said, things will work about 50%. You'll still feel fine. It's only till about 40% that things are working that we have symptoms. So there can be no symptoms, but other symptoms commonly we see: headaches. Most headaches are coming out of the neck, stress, fatigue, sleeplessness, being tired, a little energy. All these things besides pain can mean that there's something going wrong in your spine. All right, so trauma, a lot. When I meet a new patient, I'm always asking about car accidents, falls, and more often than not, there's some sort of injury, even if they're younger, that cause some irritation or problems in the spine. We see a lot of motor vehicle accident patients here. People think you have to get in some big car wreck and the airbags have to go off and your car's totaled to cause an issue. But we found any kind of motor vehicle accident above 5 miles per hour causes damage to the spine. There's ligaments that hold all these bones together. And I tell patients kind of like a rubber band, and when there's a kind of accident injury that gets stretched out, and it can cause damage to the spine at just 5 miles per hour. So even that little fender bender at Walmart, Target, that can be enough to do something to you. Broken bones, most kids end up breaking a bone. Thank goodness never broke a bone, 47 years old, but broken bones obviously going to cause some issues. All the time I hear childhood falls. So I have a patient with bad low back pain, or especially real lower. Did you ever fall or anything? No. A couple of visits in, they'll say, you know what, I was sleigh riding when I was 10 years old. I hit a huge bump and landed on my rear end. I had a lot of pain afterwards. So all those little falls, kids fall more. They say if you fell as much as a 3-year-old in one day, you'd end up in the hospital, right? So everyone with a toddler knows they're falling constantly. If you did that much falling as an adult, you'd be hospitalized. And all that trauma does add up to the kids as well. So that's why it's important to get your kids' spines checked as well. Lack of spinal exercise. So a lot of us, unfortunately, not me, but a lot of people are at desk jobs. We're sitting all day, hunched over, spine's not moving properly. The spine gets hydrated and fluid by movement, and we're sitting all day or sitting in a car, truck, sitting at a desk all day. It's not able to regenerate and get some nutrients in there. And then a little slip or fall. I mean, every day I treat someone that slipped on the ice, they fell, all those kind of little slips and falls, they add up. And the other thing with those, they're usually a cumulative effect. So more times than not, it's not one big fall, it's that we had a bunch of little falls, and those things kind of add up over our lifetime and give us a problem. All right, so posture, so big posture. Everyone's kind of coming along to posture now. Chiropractors talking this for 100 years now, but with the advent of more desk workers and working home workers, we're finding this to be a bigger problem. So there's a picture of this nice lady here. Some things we're going to look at. We want to see the pelvis nice and straight. So when this is over, go ahead and look in the mirror and check this out. So you can see people's, I see it all the time, their belts are crooked or their pants are crooked. We'll see there. Next, we want to see the shoulders nice and even. So we're standing up tall and straight in the mirror. We want the hips even, shoulders even. Next, we're going to look at the position of the head. So we'll kind of look at the two ears, should be about the same level. So like somebody in the front, we want to look at hips, shoulders, and ears nice and level. So when you get a chance, just stand in front of the mirror like this and just see if your hips, shoulders, and ears are nice and straight and even. A lot of times you'll find lower back shifted this way. We got a shoulder higher from neck tension, or we got a little head tilt, which could mean there's some sort of spinal problem as well. Side view too. And those are your patients, or if you're not patient, we have a digital posture analysis system. We do this in the office, so we'll do something very similar to this, and it'll actually analyze it and give you readings, degrees, and all that kind of stuff. Side view is important as well, especially with the desk at workers nowadays. We're looking for here, we want to see the ankles, knees, hips, shoulders, and ears in line. That's what it should look like. Now, if you look at yourself, or 90% of the people nowadays, we're going to see this on the side view, which we see all day. That ear being over the shoulders this way. A lot of people are on desks and doing this. And it's not just posture how you look. I mean, for one, people ask me how come grandma's in a walker when she's 70 years old. This is when it starts, when we're 40 and we're doing this, and then we're 50, and then the next thing you know, we're in a walker when we get older. So we don't want that for you. So we want to make sure we're maintaining nice spinal health. Also, what we found, I was at a conference not too long ago, one of the speakers talking, they're finding bad posture, especially post-COVID, isn't just bad posture and walkers and those things. We're actually finding it's decreased heart and lung function. So when we're like this all day, if you even do this, you can't get a good breath in, right? So we're up, we get that air in there. We're finding heart and lung issues from years of this chronic bent over posture. We're putting strain on the heart and lungs in there. And they're finding actually increased risk of heart problems and lung problems with this desk posture that a lot of people are walking around with. All right, so how do these things go? When we interrupt the nerve supply by one of the subluxation, it makes the tissue not work properly. So something will not be working properly in the body from that, which then causes things not to function or work properly. Then we get symptoms, then we get disease. So back when we were talking about health isn't just the absence of any kind of disease, this is kind of how it works. So those nerves are irritated, nothing happens for a while. So the muscle, say it's a nerve to your bicep, the nerve's irritated, you don't really feel anything. And muscle's just not quite working properly. That's the malfunction, doesn't quite feel right. Then we usually get symptoms. Then it'll hurt. And then if it's something that processes onto a disease. So nothing just goes right from a small problem into disease. It's a process. And this is a long time, a lot of times. I just had a lady left today. Her neck looked pretty young. Her neck looked like she was 30 years older than it was when we x-rayed it. And I said this was a process that started 20 years ago. It wasn't a fall that happened recently. It was a process that happened quite a while ago. So it's real important to know that a lot of problems can be brewing or going on long before we even have symptoms or we have a major problem. All right, so this is our smoke alarm, fire alarm. So I tell patients a lot of times, pain is like the fire alarm going off in your house, right? Trying to tell you that there's a problem going on. Now, the fire alarm's going in your house. Do we just unplug the fire alarm or turn the power supply off? No, we want to find the cause of the problem. And that's the way your health works too. So a lot of times in modern society, we have some pain symptoms, end up popping some pain pills or maybe getting some needle injections in there. And that's just kind of turning the fire alarm off. The body's trying to tell you there's a problem. So when you have those pain or symptoms, the body's saying something's not right. We need to get it addressed. And as chiropractors, what we do is look for that cause of that problem and try to correct that cause and really get the problem fixed. So here's one of my favorite charts here. We go over this a lot with patients. You'll see these up in the office. There's our little nerve pressure chart. So up top, if everything's nice, straight in a line, nerves working properly. Unfortunately, most people wait till we got a lot of nerve pressure or pain in here. So the joint's out of place, putting pressure on the nerve. People come in looking like this, unfortunately. We wish they came in like this, but a lot of times they come in like this. And it takes a series of care to get them across the pain line, get them feeling better. At that point, that bone is just barely off of that nerve. So I tell people it's like my hand here. Ideally, my hand's here. Once it's touching it, you feel it, right? But if I just move it a millimeter off, I don't feel that anymore. It feels good. But the problem is you bend or move just a little bit and it hits it again. So what we want to do is not just barely get the pressure off there. We want to make sure we get it as good as we possibly can. So once it's barely off the nerve, a lot of times patients sometimes will quit care. Problems come on back and we see them come back in the office. That happens dozens of times a day, unfortunately. and then they go through and correct the problem. But really the best way is to fix it right the first time. We got the pressure on the nerve. We barely get it off, so we feel good. We think we're good. What we want to do then is really correct it. The analogy I give a lot is like braces on teeth. A lot of us, unfortunately, had to pay for braces for their kids. They're awful expensive. So we get braces on teeth. They straighten the teeth out. That's like getting right here. And then what half the kids do, they don't wear their retainer, right? So they don't wear their retainer, their teeth get crooked, and then they go back and spend $4,000 on Invisalign when they're adults to get the teeth corrected, and then they learn to wear the retainer. I did the same thing, so I know, but that's exactly how this works. This is like the braces, we got it straightened out, but if we don't do the retainer to keep it in place, it comes right back, and then we got to do more work to fix it. So good analogy for your braces, and make sure your kids wear it. So we talked a little about those disc issues a little bit earlier. We're one of the few offices in the area that do non-surgical spinal decompression. That's an advanced form of traction table that you'll see me laying on there. It's going to traction the spine, open up the spine. And it's one of the only non-invasive treatments able to suck that disc off of that nerve. So if you know anyone with slip disc, bulging disc, spinal stenosis, it's one of the only treatments really, besides needle injections or major spine surgery, that's going to get pressure off those nerves in the back by tractioning over that spine. It's one of the most advanced treatments. We have 2 tables here. Nobody does more spinal decompression in the county than us. This shows you a little bit more about that, the disc issues. So we got the bones of vertebrae we talked about. The disc is the body's spacer or shock absorber in between, so that disc material can slip, bulge, or press out and put pressure on that nerve. And that decompression table is able to traction or pull that disc off of that nerve and get you relief without needle injections or pain pills. We don't want those. Another advanced treatment that we do here is class 4 laser. So laser treatment's a new advancement in the last 10, 15 years. Lasers are great on classes. So class 1 would be like a laser pointer, doesn't do anything. Class 2 is more like a CD player for people older like me that does a little something, but nothing therapeutic. Originally, class 3 were in medical offices. We actually had one. I think it's in the closet, or maybe we got rid of it. Not as much power. It's able to decrease some pain and swelling, but now the latest is class 4, which we have here. So class 4 laser is able to penetrate deep in the tissue. It's the only modality that can decrease pain and swelling, also make you feel better, and also promote healing. So it stimulates the cells to regenerate a little bit. It's able to really do well for chronic arthritis pain. I've had patients cancel knee replacement with laser before. Great for any extremity problems, elbows, knees, hips. Really good on the knees. The knees are a great spot to do it. That inside knee pain from arthritis works great for that as well. There's a picture of one of our staff getting laser treatment on the knee. It's nice red light, real calm, relaxing. You just lay on the machine, takes about 10, 12 minutes, gives you some pain relief in 10 or 12 sessions there. We also do some kinesio taping and other therapies here as well. That was kind of unique when we started doing it 15 years ago. Now, obviously, you'll see it a lot. So I show this analogy to people a lot. This is your pencil with a worn out eraser. Think of those discs we were talking about, those little shock absorbers. When they start wearing out as we get older, they start drying out a little bit. We're rough and tumbling. Just treat a farmer today, some worn out discs. We wear down those discs, and eventually we're kind of bone on bone. So patients will say that about their knee or hips all the time. The orthopedic will tell them the same thing happened to the spine, but unfortunately there's a nerve between those bones like we showed you a few times, and there's pressure on there from those vertebrae and disc wearing out. It's really gone forever. They haven't gotten any good disc replacement surgery or spinal replacement surgery. They'll put some screws in there, but there's no way to really get that disc back. All right, so what do you do when you're a patient of ours? If you're not a patient already or you're thinking about it? So our number one goal is get you out of pain. You know, we talked a lot about pain's not the only thing, but obviously you come in here to get out of pain. We want to get you out of pain as soon as possible, but then we want to correct the problem. So we don't just want to get you pain, we want to fix the problem underneath. I want to get motion back. A lot of people come in, they're stiff, or we don't have the golf swing because we can't rotate, those kind of things. Return to normal activity. So little things that you're missing out. If you're pretty healthy, you know what this is like, but never forget, I was pretty new in practice 18 years ago. I had a woman pretty old, maybe in her 80s then. And she came in tears once because she was able to go to the grocery store the first time in 10 years because we did decompression on her back. She was able to go grocery shopping. So some of those little things, you can't pick up your grandkids or kids, can't golf anymore. I just treated a gentleman couldn't live his whole life for golf, then retired, and now he can't golf anymore because he's got some physical problems. A lot of people, athletes come in for improved performance. We treat a lot of athletes, golfers, football players, all that kind of stuff. And we want to make sure everything's working as optimally as possible. So again, it's not just about feeling good, it's about optimal health. All right, so when you treat, we come to the office, what's some of the stuff we see? Low back pain is the number one health problem in America. By far, 8 out of 10 adults are going to experience a pretty serious amount of low back pain. We're sitting too much. All these things add up to a lot of low back pain. So that's number one in pretty much all doctor's offices. Number two is going to be neck pain. We're all sitting at computers hunched over like we've been talking about, cause a lot of neck pain. Headaches, like I said, a lot of people sometimes try a lot of medications, go run around a lot of doctors for headaches. 80% of headaches are coming out of the neck. So other issues, eye, ear, that stuff, but most of them are coming out of the neck. So we build up tension in the neck, irritates those nerves coming up around the head. So that's a big one. A lot of people don't know, back 60 years ago, chiropractors didn't do a lot of extremity conditions, which are hands and feet and elbows, knees, that kind of stuff. We treat carpal tunnel here every day, which frozen shoulder, plantar fasciitis, hip pain, elbow pain. We get golfer's elbow, tennis elbow, all that stuff we can help you out with. Treat a lot of athletes for all kinds of sports injuries and a lot of other things. I just adjusted somebody for TMJ. I've had a couple TMJ patients this week. People don't realize you're clenching, grinding, stress in the jaw can cause disruption in the TMJ, and we can actually adjust the TMJ joint and get really good results with that as well. Whiplash, we treat a lot of car accident patients, a lot of people unfortunately in car wrecks in New Jersey because of where we live, and it caused a lot of damage to the spine. I just had a family of three. Between the three of them, they had 8 herniated discs from a car wreck. They were all in together. All right, so what do we do? So we talked about the posture. We do the posture analysis. We do orthotics here if you need them, for insoles for your shoes, for plantar fasciitis. We do a lot of therapies. We have the laser machine we talked about, ultrasound machine. We have the intersegmental traction tables. We do non-surgical spinal decompression. We are experts in the area. We've been doing it for 15 years. No one's done more decompression in North Jersey than us. We have 2 tables. Our staff are really well trained in that. Other exercise, health advice, prevention advice, exercises, stretches, things to do at home. All right, the best part of our treatment, tell people, is that there's no needles, no drugs, no scalpels, right? So if you do come into the office, you go to a chiropractor, the worst result is that you don't feel as much better as you'd want. But if you go get major back surgery, there's no one doing that. If you come in here for 4 or 5 weeks, it's not feeling better, you might have wasted a little bit of time. That's about it. But if you go and get major spine surgery, just treated a patient tonight, had spine surgery, was out of work for 11 months. So if you get major spine surgery, it's going to be $40, $50, $60, $80,000. If your insurance doesn't cover much, you're out of work for, I said, gentlemen, tell you 11 months out of work. And sometimes it doesn't work, and you did all that, and you might be worse off, and you can't undo that. Once they put screws and rods in there, nobody's going to take them back out. So if it doesn't work, there's really not much side effects at all. So we got a lot of testimonials. One of our patient, John, been a patient Dr. Fetch about a year, came here with tremendous low back pain, hard to walk, and started coming here, straightened out, it feels so much better. Another one, I noticed difference on the first treatment on my decompression table. Third treatment, I got my back and legs back. So we're someone who had leg pains for quite a while. We did some treatment on her, and she was able to walk and get her leg problem going back. It helped her so much. She used to stay up at night crying because she thought she was going to be in a wheelchair. Thank God for Village Family Clinic. So saving somebody for a wheelchair is a pretty cool thing that we do here. That's our office. Is a little bit outdated, actually. We made this presentation a while ago. We have over 600 5-star reviews. There's nobody with that great reviews around. Another testimonial. This patient's been a long time. She's going to Village Family Clinic a couple months. She helped me a lot with my sports injuries. Every time I get adjusted, I feel better and refreshed. Peyton played a lot of sports. She's actually out of college now, all grown up. There's Maria, chiropractic care has improved my life every time I'm adjusted. She works retail on your feet all day. It's a tough job. She's able to do her job better without hurting. Tell everyone to come in here. I always feel a lot better. Most pleased with flexibility. You come in when it works for you. We don't make you wait. Just have a conversation with this. Some friend at a doctor's office for an hour and a half. We're going to see you. We have pretty much a no wait policy here. You'll be seen within 15 minutes of your appointment. 99 out of 100 times you don't wait at all. You come in, you're in and out in 5-10 minutes, and people are very busy to be doing that. And we have dozens of these on our website you can read. So we always say, you deserve to be healthy at Village Family Clinic. That's in front of the office. You know what it looks like. We're in the Alamucci Corporate Center again on Route 517 in Hackettstown's the mailing address, but Alamucci. Website's down there as well. That's us on the map. We're just a mile off Route 517, just a mile off Route 80, right past Panther Valley. And that's the big sign up front. If you're on 517, you've probably seen it. But if you're looking for us, you'll see that nice big sign we had put in. All right, so gift to you, anyone listening to this or in the clinic here, we're going to do free myovision back scans for you. So you're local to the area, we'll just call, text, email. The office is closed right now, but just send a text, 908-813-8200, or you can email any way you want to contact us, but text is probably easiest. We do a free digital myovision back scan. So this is a pretty advanced technology we have here. Remember the brain, spinal cord, and nerves. We put EMG, electromyography probes up and down the spine. It's totally non-invasive. We just take the probes up and down the spine, take some measurements. That's able to tell us if we're having any problems here. So ideally, both sides are green or good, and that's normal. On the left is someone with symptoms. we're seeing red. That means some of those nerves are probably getting irritated from those misalignments or subluxations we talked about. So if you just mention you're on this webinar, we're doing these scans for you absolutely free, no cost, no obligation, no insurance. Just give us a text, 908-813-8200. So let us know you're on here. You want to do a free myovision spine scan if you're local to the area. So that is it for tonight. I want to thank everyone for coming to the great seminar. Hope we have a great night, and we'll see you all in the clinic real soon.